So today we're going to talk about some pretty basic but really helpful information about ADHD in children. And one of the most stressful aspects of having a child diagnosed with ADHD is that it can be really difficult to understand whether or not it's a good idea to try medication. Hey, Nick, thanks for joining us.
Hey, sorry for being a bit late. How
That's
are we?
okay. We're just getting started. I was starting to introduce the topic that we're going to be talking about. The presentation is called Three Truths and a Myth about medication usage in kids who are diagnosed with ADHD. So before we get started, I wanted to remind everyone that I am not a medical doctor. I am a therapist, and my training is as a school psychologist. So I have extensive experience in working with kids with ADHD and their parents, right? Because so much of managing ADHD has to do with how parents support their kids. So before we get started, I'm just going to reintroduce myself. Welcome to our free parenting webinar series. We have weekly discussions on a variety of topics every Monday at noon Eastern Standard Time. And so you can listen live, like some of you are doing, which I appreciate, or you can register and have the recording sent to you at a later time, and then you can watch it at your convenience. So whatever works for you is what I want you to do. And if you watch a presentation and you have questions, I really encourage you to reach out and email me, and you'll see my email address at the end of the presentation, but it's just drtaraegan@gmail.com. And then if you get wind, if you're following us on social media and we give a preview of what we're going to be talking about next week, then feel free to send in a question so that it can be something I can address in the presentation. So once again, I have a doctorate in school psychology. I have additional training in mental health, in mental health clinic, as a mental health clinician, and I'm a therapist that works primarily with children, adolescents, and their parents. And I've had many, many years of experience in working with kids with ADHD. So let me scroll down here. So today's topic, we're going to talk about 3 truths and a myth about medication usage with kids diagnosed with ADHD. And it's coming from my perspective as a therapist. And so if you were to be interacting with a psychiatrist or a pediatrician or an occupational therapist or a teacher, you might hear a little bit different information, but I am trying to present information that is really research-based and pretty objective versus me telling you my random opinions about things, because you can form your own opinions, but I want your opinions to be formed from solid, consistent information. So briefly, we're going to talk about what ADHD is, just for some of you who aren't familiar with exactly how that's defined. ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a chronic condition. It's something that when we note symptoms in kids or adults, that we tend to see those symptoms for the span of their lifetime unless they're given treatment. And we're going to talk about different treatment options. But it's not something that kids will have in a very transient way. It's not something like, oh, my child had ADHD when they were 5 and they were in kindergarten and then it went away. It's something that if we really have an appropriate diagnosis for a child or an adult, it tends to be something that needs to be managed throughout the lifespan. Although some people are so responsive to treatment that their symptoms are really minimized because it's so well managed. So sometimes parents will say, or adults will say, oh, I grew out of it. And really what that stems from is them developing and treatment options and them responding to those treatment options in a way that really causes the symptoms to be minimized. So there's 3 primary types of ADHD. There's what's called predominantly inattentive. So this is where we see kids who struggle with attention and concentration. And so they might be prone to not paying attention to details, making careless mistakes in their schoolwork. They might have a hard time remaining focused on tasks, and it can be tasks that are kind of boring for them, or maybe new tasks that take more mental energy to master. Sometimes these kids look like they're not listening or they're ignoring you. And these are kids who struggle to follow through on instructions, especially when it comes to schoolwork. And so they might fail to follow the directions, or they might fail to do the final step of the activity, like turning the assignment in. That is something that's a real chronic problem for kids with ADHD is parents will say, oh, well, they did their schoolwork, but then they just didn't turn it in. Or they did their schoolwork and they left it on the kitchen table and didn't bring it back to school. These are kids who struggle with organization. So sometimes they're really messy. They can't find things. Sometimes they can find things, but it's done in a way that feels very, very inefficient to individuals who don't have ADHD. It can be stressful for these kids to do tasks that require a lot of mental energy. So these kids can get fatigued quicker when it comes to working on a difficult task. And so that can make it seem like they don't have as high of a work ethic, or they lack motivation, or they're quick to get lethargic in the process. But in reality, these are kids who it's just a larger strain on them to be having to harness their attention and focus, especially in an activity that's new or difficult. A lot of times these kids lose items. So they'll, I can't find my baseball equipment. I don't know where my bathing suit went. I have one flip-flop, but not the other flip-flop. And so it can cause a lot of frustration for parents because they can feel sort of like disrespected because their kids were always losing things. So, and then follow through with things like chores, going through the steps in a productive way to a morning routine, things like that. So those are all symptoms that you might see if your child demonstrates the inattentive characteristics of ADHD, which honestly most kids do. When it comes to the hyperactive and the impulsive characteristics of ADHD, these are things like kids who are very fidgety, they squirm in their seat, they're very wiggly. They oftentimes have a hard time staying seated in the classroom. So these are kids who might be prompted to return to your seat. You need to sit on your bottom, sit crisscross, stop walking around. A lot of times these kids appear to be in constant motion. So it can be very wearing on parents when it feels like their kid is going, and never pauses until they fall into an exhausted heap at night. So we might see these kids climb on things. They can scale a bookshelf, or they're climbing up the slide on the playground in the opposite direction, and some kids are getting annoyed or falling off. They are louder. Oftentimes they're, the loudest force in the house, and it feels like they're always talking in an outside voice. Sometimes they talk at increased speed and go on and on about something and just feel the need to really talk and talk and talk. So they can be kids who interrupt a lot. They can be kids who have a hard time waiting their turn. And so this can be frustrating for kids when they're playing with a peer and they don't want to wait their turn, or they have a hard time being patient and listening carefully to the rules of the game. And then combined, that last subtype of ADHD is when kids have a mix of inattentive symptoms and hyperactive impulsive symptoms. So honestly, in the work that I do, because most parents who reach out to me individually as a therapist are parents who are concerned about their child's behavior. They feel like they're in power struggles. They feel like they're yelling often. They feel like their kids aren't listening. Oftentimes the kids that I work with who have a diagnosis of ADHD, I'm seeing that it's the combined type. And sometimes when I work with kids, they've already been diagnosed and they've gone through the process of diagnosis. Other kids are showing the symptoms, they haven't received the diagnosis, and parents are trying to get some support from a mental health clinician to support their kids, behaviorally. So let's start to talk about the truths. Okay, so truth number one is that ADHD is a neurodevelopmental disorder. So this means it's a brain-based disorder. This is not a situation where your kid is just naughty or disrespects you. There is actually a different way that their brain is functioning that results in these symptoms. So we know that there's several parts of the brain that are impacted. And I don't want to belabor this because this is something like you could Google, but we know that kids who have ADHD, their brains have imbalanced levels of neurotransmitters. So you see the word dopamine here. And I think that most of us have heard that this is the neurotransmitter that's responsible for that euphoric feeling that people get when they are doing something really exciting. So a lot of times with kids like this, they have lower levels of dopamine. And so they're always seeking to get that rush, which can help contribute to why they're so focused on, being loud, being expressive, seeking sensory stimulation. We also know that ADHD impacts 4 different regions of the brain. And most of the time when I talk to parents, to keep it simple, I talk mainly about that prefrontal cortex, which is the front part of the brain. And this is the part of the brain that's really responsible for executive functioning skills. So planning ability, impulse control, delay of gratification. And so a lot of times when children are given medication to try to relieve symptoms of ADHD, it's really designed to have that prefrontal lobe work more efficiently, because we know that the brains of these kids, there's aspects, the parts of the brain that are responsible for executive functioning are not working as efficiently. So those medications are designed to stimulate that area so kids can harness some of these skills that they need to be successful in school and successful in relationships and things like that. We know that the limbic system is also impacted. And so this is an area that's deeper in the brain. It regulates our emotions and our attention. We also know that the basal ganglia, it's where the brain is like having a conversation with each other. So if that's not working efficiently and there seems to be some sort of like short circuit or just not efficient communication, then we see those characteristics of inattention and impulsivity. So that delay of gratification can be really difficult for kids with ADHD. And then the reticular activating system, this is like the relay system among the pathways that enter and leave the brain. And so we see that kids who have this area of the brain impacted, once again, it contributes to these symptoms of inattention, impulsivity, and hyperactivity. So it's important to recognize that this is not a disorder that kids are just going to kind of walk off or just grow out of, because it's brain-based. It's something that impacts their actual development, how they're growing as a child. So to think that they're going to grow out of it or they'll just learn to manage it. Sure, if you don't give them any treatment, they're going to figure out ways to exist, but their existence is probably going to be considerably more stressful than those kids who receive treatment for it. So that's truth number 1. Another thing I want to mention about, just as a continuation of truth number 1, is that there are factors that are involved in the development of ADHD, because remember we talked about it being a brain-based disorder, is we know that kids who have a family history of ADHD are more likely to have those characteristics themselves. So oftentimes when I work with families, I'm looking to see, through questioning the parents, is there a family history of it? Does this child have a sibling or a parent who has ADHD or symptoms of ADHD? Because it could happen that they have the symptoms and never received a formal diagnosis. And oftentimes when I work with a child with ADHD, parents are pretty upfront about that they demonstrate some of the same characteristics, which can be really stressful in a household if we have 2 individuals, or at minimum 2 individuals in the household who are struggling with things like impulsivity, hyperactivity, poor attention, poor concentration. So that is like kind of a red flag for me to say, all right, we might be onto something here if we're seeing a family history of it. We know that kids who might have had disruption in the development of their central nervous system are more likely to have symptoms of ADHD. So if a child is born prematurely, if they've been exposed to toxins, things like chemicals in their environment, or maternal use of tobacco or drugs, things that could impact the development of a child's central nervous system, we know those are risk factors for ADHD. And then the last thing is the environment. If we have kids who've been exposed to domestic violence, if they have had excessive use of technology, we know that can have an impact on kids' brains, and then it can result in kids demonstrating symptoms of ADHD. One thing I want to note here is your child is not going to get ADHD from eating a lot of sugar. So that's something that is just a myth. That's not the myth that I'm going to talk about in this presentation, but I did want to mention it here under this environment section that we have here, is because I hear that all the time of, oh, my kid has ADHD, and I'm separated or divorced from their dad, and dad gives them too much sugar, and that's why they have ADHD. There is not a relationship conveyed by research that indicates that sugar consumption actually contributes to a neurologically based diagnosis of ADHD. Your kid could have a sensitivity to sugar, or you might see a short-term impact of sugar usage, but that is not a contributing factor to kids having an actual diagnosis of ADHD. And it's also important to know that early diagnosis and treatment of ADHD can make a big difference in outcome. So as soon as possible, as early as possible, when kids start to learn some strategies and coping skills to deal with their symptoms of ADHD, it really contributes to less stress on the child, higher functioning, less disruption in the home. And so we're going to talk a little bit more about this, but it can be difficult for parents as they see their kids start to display some of these symptoms for them to sort out, like, is this a normal, like, rambunctious preschooler here? Or is there something that might be more significant? And how do we sort that out? So having those thoughts and not consulting with professionals can result in a delayed diagnosis of ADHD, which isn't the end of the world, but it does mean that your child has had a longer experience with having lower functioning, maybe getting negative feedback from peers or teachers, and that just has the child be in a state of stress longer than if they received treatment earlier in the process. Let's talk about truth number 2. So when it comes to ADHD, there isn't like a blood test that we give kids to see, like, oh, what are your dopamine levels? Or, how well is your prefrontal cortex functioning? Like, it's really based on observation and the report of individuals in that child's lives. So we might give questionnaires to teachers and parents. We might do observations in the classroom or at home. And we start to see, is this child demonstrating the symptoms of ADHD? And if we can kind of check off that there's a bunch of symptoms that child is exhibiting and they're severe enough to impact their functioning and they're across settings, then we start to have a suspicion that a child has ADHD. So when I say across settings, I mean kids don't have ADHD just at church, or they don't have ADHD just when they're following their parents around the grocery store. We see that they have those symptoms across settings, which means more than one setting. So we'll see those symptoms at school, we'll see those symptoms at home, we see those symptoms in the community. And so when we start to see that those symptoms are pervasive in that child's life, then that is also a strong indicator that ADHD might be a diagnosis that's warranted. And so our focus when it comes to treatment is focusing on strategy development and coping skills. So strategy development is when we're teaching kids how to develop or use appropriate organizational strategies. These are not kids who are necessarily going to make a mental list of things to do and then follow through on doing them. They're going to be the kid who really benefits from having a posted sign up that says exactly what the steps are that they're supposed to do in the morning. They're the kids who are going to have a kind of like a plan when it comes to organizing their school materials, or maybe parents use some different organizational strategies in their bathroom or in their bedroom to help them access the resources they need. So as kids grow, we really encourage kids to make use of the technology that they have access to. Having a 12-year-old with ADHD be able to use the calendar app on their phone to keep track of due dates is a really, really functional skill. Whereas for kids who don't have ADHD, they might have a sticky note and it's stuck to the side of their folder, and that's kind of all they need to cue them. And it's not any more complicated than that. But kids who really have strategies to not only stay organized, but to calm themselves down, to speak up for themselves, to approach an interaction with a peer, right? They might cue themselves of, okay, I have to not just be thinking about what I want to say to this person, but I have to actually pay attention to what they're saying so that I can be a good friend and respond in a way that is meaningful and supportive and kind. So these are kids that we support with strategies with organization, with emotional regulation, how to keep their body calm, how to express themselves, as well as with social skills. So we're not looking for this like cure. We're really looking to manage ADHD in a way that works for that particular kid. I remember back when I was a school psychologist, I worked with a principal who was very open about the fact that he had a diagnosis of ADHD, and he had a process every morning that helped him remember the tasks that he needed to do in sort of like his morning, like the first part of his day. And he used to take these plastic cups and put them on the counter. And he'd line them up on this spot on the counter that was right near the door. And he would, in each of those cups, symbolize something that he needed to remember. So like the red cup meant grab your keys. The blue cup meant make sure you have your cell phone. The green cup meant make sure you have the file that you brought home from work yesterday. And so he would cue himself with these visual cues, and his family knew not to touch those cups. They knew that that was a strategy that he used to tap into his memory in the morning so that he could start off his workday in a really productive and professional way. So there's a lot of cueing that kids can learn to do with themselves, for themselves, so that they can stay organized, that somebody else who doesn't have ADHD might not need to do. Okay, so we are focusing on strategy development and coping skills. If we look at the research, the best practices indicate that the most effective treatment for ADHD is a combination of medication and behavioral interventions and counseling. And so, like, that's in an ideal world, right? If your child responds well to medication, if you're, as a parent, are comfortable with trying that intervention. But there are times where kids either just use medication and they don't do the behavioral supports side by side, which is not ideal, or they receive the counseling and the behavior interventions, but they don't have the support of the medication, which also means that they might not be tapping into the most efficient way to treat ADHD. The thing is medication usage is often really stigmatized. There's a lot of parents shaming parents if they use medication to treat their child's ADHD. And I would like to point out that the parents that are oftentimes the most shaming are those who don't have children with ADHD, or they don't have a family history of ADHD. And so it's really easy for them to make assumptions about how they would, if they were that child's parent, how they would address it. And it's really important that parents be very informed about their decision-making process when it comes to medication. So sometimes when I talk to parents and they express immediately without any, knowledge or any just information gathering, like, we don't want to use medication, that just seems like a terrible idea. And that's fine. I certainly would respect their opinion on that. The only thing I offered as a suggestion is just make sure you have an informed opinion for your child. And so it's really important to consult with the appropriate professionals, which oftentimes is a trusted physician, an MD. So this would be your child's pediatrician, a psychiatrist, a developmental pediatrician, like individuals who have extensive experience in working with kind of the medical side of that diagnosis. And so if you ultimately decide to not try medication with your child, I think that's fine, but just do it with a really informed perspective. A lot of times parents, when they first find out that their child is diagnosed with ADHD, or that that's an appropriate diagnosis for their child, they're not in a place where medication seems like a viable treatment. And so they might speak very negatively about the process of medication in front of their children, in front of their spouse or extended family members. And then if later on, based on your child's progress and development, they demonstrate that there's a need for medication, sometimes I see that kids have this residual feeling of shame, or they even say no and will refuse to take medication. And now we have another problem behavior that parents are trying to tackle. So if parents decide that medication usage isn't for them or for their child, I think that's fine. But just be mindful of the fact that if that ever is something that you want to consider, you don't want to taint the process by speaking negatively about it with your child, and then it just turns into a power struggle later on. Let's talk about truth number 3. ADHD doesn't cause other psychological or developmental problems. However, we know that there is an increased what's called comorbidity. Okay, so that kids are more at risk to have an additional diagnosis of these things. if they have ADHD. They are more at risk for showing symptoms of ODD, conduct disorder, learning disabilities, anxiety disorders, mood disorders, autism, tic disorders. And while I would love to have the time to go through each of these disorders, we don't have that time today. But it is important to recognize if your child has ADHD, you do want to keep your eye out for other things that could be influencing their behavior or their success in school, and make sure that you're addressing each of those things in a comprehensive way. So a lot of times for me as a clinician, I'm seeing that kids are struggling with ADHD and some behavioral issues, whether it's oppositional behavior, saying no, not following rules, or it's anxiety, where these kids are really, demonstrating fearful behavior, want to avoid things, don't want to try hard things because they feel anxious. They show, some sadness and anxiety about speaking up for themselves or forming friendships. Those are some things that I see day to day with kids that have ADHD. But all of the things on this list, they are at an increased risk for. But it doesn't mean it's like they're going to get these things. They're just at an increased risk. So it's really important as you work with clinicians that you work as a team to monitor symptoms that could be related to some of these other things. Let's talk about a big fat myth, okay? So the myth here is that there's this repeated belief that I've heard, honestly, several times over the last couple months, is the idea that if you use medication to treat your child's symptoms of ADHD, that they're later on going to become like a drug addict, that they're going to get addicted to these ADHD meds. And I went back in and reviewed the literature on this, and there is not research that supports this, okay? In fact, we see that kids are more likely to resort to misusing drugs or alcohol if they don't have appropriate treatment for their ADHD, because it is a stressful diagnosis. I mean, these are kids who struggle oftentimes in school. These are kids who might struggle with maintaining, calm and not getting angry or frustrated quickly. These are kids who struggle with being able to use technology and social media in a moderate way. It is a more stressful world to be in if you have a brain-based condition that impacts your ability to concentrate, to attend to things, to pick up on social cues, to manage anxiety. Like, that is the reality. And so if you have a child who isn't receiving treatment and they're experiencing all the stressors of having this diagnosis without the support, without having the coping strategies and the behavioral strategies to make life go more smoothly, then they are more likely to sort of self-medicate or resort to misusing drugs. Okay, so I do want to say, though, I do want to acknowledge that there are kids out there who will take an ADHD medication like Ritalin or Adderall and misuse it. They can, you can take higher doses of it, you can snort it, you can do different things to misuse those medications. And oftentimes the kids who are misusing those medications are kids who shouldn't have been prescribed it to begin with. They bought it off some kid at a party. And I've seen this in cases where kids who don't have a diagnosis of ADHD but are in a really competitive, demanding educational environment will want to take Ritalin, for example, before a big exam because they feel like it's going to sharpen their focus, and that can be a misuse of medication. But as a general, rule, what research is telling us is that these are not kids where, because they used ADHD medication in an appropriate doctor-prescribed way, they're not at a higher risk of abusing drugs or alcohol at a later stage, particularly the drugs, misusing the drugs that the medication that they've been prescribed. So that is a big myth. So I do want to put that to rest, those fears to rest in parents who are hesitating to get informed about medication because they've heard this myth out there that if I, give my 7-year-old medication to treat their ADHD, by the time they're 12, they're going to be, drug addicted and they're going to need to go to rehab or something like that. That's a very fear-based thinking, and it can really prevent your kid from getting access to appropriate treatment. The goal here is that we want kids to be able to access their strengths. And sometimes when kids use medication, they are more equipped to access the strategies that we're trying to teach them. So if we have a kid who's really struggling with impulsivity, really struggling with poor concentration, and we're trying to teach them new strategies to use, but they can't access it because they don't have, the most severe symptoms reduced through medication, sometimes it can feel really frustrating because it can feel like they're not responding to the behavioral interventions or the counseling. So that's something that, parents can be mindful of. Couple last things I realize we've gone a little longer on time. How can you help your child with ADHD? First of all, gain acceptance of your child's diagnosis. It is a big deal anytime our kids get a medical diagnosis. And as parents, it causes us a lot of worry and stress and sometimes even grief. And so we want your decision-making about your child's diagnosis to be based on their needs, not on your emotional reaction to their diagnosis. And it's really important to find a doctor and a mental health professional that you trust. As we all know, not all clinicians are the same. Not all clinicians have the same training or the same degree of compassion and empathy. So it's really important that you take the time to find somebody that you trust and feel like they are interested in your family, are vested in your child. And once you find those professionals, really collaborate with them in treatment for your child. Make sure you separate facts from fear and myths. There's a lot of information that can be accessed out there when it comes to ADHD. It's really important that you go to trustworthy resources, medical professionals, information that is from organizations that are really well supported by research. So I'll give you an example like the Mayo Clinic. That is a website that has a lot of really helpful information about any disorder. And it's really trusted and it's really based on research versus like a random blog from a parent who has a child with ADHD. So really be mindful of where you're getting your information. I also want you to recognize that regardless of your child's diagnosis, they absolutely have strengths. And the goal of the process of treatment is to allow them to access those strengths. Okay, we want to kind of clear away some of the things that are the most stressful or interfering with their functioning so those strengths can shine through. And so a lot of times kids have, great thinking skills, creativity, they're like, quick to be energized. They can get very passionate about things. They have a nice amount of energy. And so we want to access those strengths and not have some of the more stressful aspects of ADHD impact their motivation and success in things. And then the last thing I want to say is as your child gets older, make sure you educate them on ADHD. If you hide it from them, you don't want to tell them what's going on, they're eventually going to find out, and then they're going to be they have the thought process of like, why didn't you tell me about this? Like, is this something I should have been ashamed of? When in reality, it's just part of their development and how their brain works. And the sooner they learn how to maximize their efficiency, the easier life is going to be, and the more they're going to be able to advocate for themselves, particularly in school and in their relationships. All right, let's switch over to question and answers.
Yeah, good stuff. So we got a couple of questions here already. The first one being, a family member has a child with ADHD and they've decided not to try medication with their son because, quote, I didn't use it when I was a kid and I turned out fine. But I know this family member struggled in school and it really impacts their performance on the job. Their child experiences these same things. Should I say something or try to change their mind?
Well, this is super hard. And this is something that I hear a lot because ADHD is so genetically based. Oftentimes I'll talk to a parent and they'll talk about a niece or nephew or a brother, adult brother or sister who has characteristics. And if those parents have, for example, worked with me, worked with a medical doctor and seen the benefits, is they want, other people in their family to see what that benefit is. And it can be very tempting to persuade them and get over involved. And so I really counsel against that because it can cause there to be some resistance and you don't know what you're talking about. I think the best thing is to make sure that if they are saying things that are just blatantly incorrect, like they're using false sources of information, to do what you can to provide them with some good resources, whether it's a great book you've read that was recommended by a therapist, or providing them with the name of the doctor that you feel like is really beneficial. And then also to let them know what improvements you're seeing in your own child. If you have a child with ADHD, sometimes working with a counselor like myself can be really helpful in having parents recognize that there's a world outside of what they are familiar with. So sometimes, parents will say, I turned out fine. And I'll say, you absolutely did turn out fine. But how much work did it take for you to get to this point? Is there a goal that you feel like you weren't able to meet because ADHD was a barrier for you? And they'll oftentimes convey that there was aspects of their development that was really difficult. I had no friends in high school. Girls thought I was, assuming this isn't, somebody who's interested in girls thought I was obnoxious and loud. I always got yelled at by my kindergarten teacher, and they'll report that there was some considerable stressors. And one of the things I say is, you know what? We have science. Like, a lot has changed since, an adult and who's living in our world right now and maybe didn't receive appropriate treatment when they were a child. Like, we have so much science that supports kids these days. And so it's really important. It's really fair to have your child have access to those things. But when it comes to family members, if there's a way you can get your family member in front of a skilled professional and let them be the voice of reason, or just providing all different sides of perspectives, or all sorts of perspectives on this issue, that's going to be preferred versus causing family conflict.
Great. And actually that ties in very well to the next question. This is, can daycare teachers diagnose ADHD? My friend has a child in daycare and she's been told that she should put her son on medication. What should they do?
So this is really tough for me to read, because it really isn't appropriate for a teacher to tell a parent that they should be using medication. So daycare teachers are not trained in ADHD. There may be some daycare teachers who've had exposure to, a professional development presentation, or some sort of, mini training where maybe somebody like myself has come in and talked for 2 or 3 hours about ADHD and what are characteristics. But individuals who are qualified to diagnose ADHD have years of expertise and really formal education in this diagnosis. And so it's not appropriate for a teacher, whether they're a daycare teacher or, an elementary, middle, or high school teacher, to give that diagnosis and counsel a parent to use medication. Instead, teachers might want to just explain to parents in an objective way, using language that is not inflammatory or really biased, what symptoms they're seeing. So they might say, oh, little Sarah has a hard time sitting on her bottom during circle time. Or sometimes I've noticed that little Sarah's voice is the loudest voice in the room. And if we ask her to use a quieter voice, it's just a moment or two before she's sort of yelling again. Or we might, hear about kids who show signs of aggression, like they're quicker to hit. And, there's 3 incidents today where little Sarah hit a peer and that peer was crying. That is objective, observable information that parents can use to decide whether or not there is a developmental concern. But under no circumstances should daycare teachers diagnose ADHD or make any judgment about whether or not medication would be appropriate.
Good, thanks. And I hope that answers that. And we have one question that was emailed to us anonymously, actually. And it says, our family has worked with you for 2 years. You've never pushed us toward medication for our son's ADHD, as we've made it clear that we don't support its use. What do you really think about medication usage in kids with ADHD? Would you use it for your own child?
Okay, that's fair. So in this situation, or to answer this question, I do have to say that it really does depend on the child. So I don't think that every child with ADHD should, automatically assume that medication needs to be an aspect of treatment. And some of that is because sometimes kids have side effects to medication. Medication is a serious thing. And so we see that some kids have issue with their appetite being suppressed, We see some kids can sometimes get a little bit emotional. We see kids struggle with sleep. And those are just a couple things. And so for parents who work to use medication as an intervention, and if it doesn't work out, it can be really disappointing for parents. So for me, it's not about like all kids should use medication or not. I really think it needs to be individualized based on the child. Where I struggle with it is parents won't even consider it, where they won't get that information from the doctor, get the doctor's recommendation. If the doctor does recommend it as a viable treatment option, to try it out. I mean, there's some parents who will try different medications. They watch for the impact on the child's development or symptoms. And then from there, it's an informed decision of whether or not, okay, we might have some side effects, but is there a benefit to this where it's worth some of the side effects, or does this just feel too disruptive and not helpful for the child? So I really want parents to be informed. So if I had a child with ADHD, I would proceed with it that same way. I would be consulting professionals who have an expertise in this. I would follow their recommendations after I found a professional that I trusted. And if they suggested that medication would be useful for my child, then I would try it. I just think that, especially in my line of work and seeing how it can benefit so many kids, I would hate to deny my child a treatment option because I have fear about it. I would want to be able to access any form of treatment that could be helpful. Another thing to note is traditional ADHD meds are very short acting. So if you give your child an ADHD med, like Focalin, for example, or Vyvanse, or something like some of these common meds, and you give it to them at 9 a.m, okay? Some of these kids, it's out of their system by dinner time. So even if you give it to your kid for a few days and you're not happy with what their response is, you're not talking about a medication that took weeks to build up in their system. You don't know how long it's going to take to exit their system, and it just kind of comes with those stressors. These are medications which really are designed to be fast acting, demonstrate whether or not it supports that prefrontal cortex, and then ease out of their system and then try again the next day. So that's very comforting to me as a professional when if parents talk about trying that intervention, is I know that it can be something that can be tried and it's not lasting in their system for days or weeks where, parents can feel really discouraged. So that's just another thing when it comes to this treatment in particular. It's a really easy thing to experiment with a little bit, and you can be in close communication with your health provider just to be able to be collaborating about dosage or about the type of medication, and you can be really responsive quickly to your kids. I hope that answers the question.
Yeah, I think that really sounds very comforting to parents that are in that situation.
I don't want to stress parents out if they work with me and they just really feel resistant, because I do know that having that initial diagnosis of ADHD can be very stressful for families and parents, and having somebody like me pressure them into one intervention or another is not helping the situation. The child is going to have that diagnosis for a long time. There's going to be a lot of opportunities to explore different treatment options, and it doesn't all need to be done in the first day. Yeah. So for me, I want to wait until parents, initiate the conversation or start asking questions specifically about other treatment options before I press them. That's not my job, is to press parents in one direction or another. It's for me to support them and make sure they're really informed.
Yeah, and like you mentioned, there's a lot of fear in that because, personally, when I'm afraid about something, I like to get informed about it, and it usually eases my mind. So, is there like any additional resources that parents can look into so that they can, ease their conscience and really help them out with their family?
There's a lot of great books that talk about ADHD that are very parent friendly. Like there's one it's downstairs in my office, but I think it's called Raising Boys with ADHD. There's the Smart But Scattered series, which talks about, how ADHD, what symptoms we see, which interventions could be really helpful. There's a lot of stuff online from really reputable sources. Like I said, some of these research hospitals like the Mayo Clinic and places like that, where there's information that's accessible right from their website. And then there's therapists who specialize in ADHD treatment, and they are great resources, and they talk about modalities like play therapy, cognitive behavioral therapy. There's a lot of resources available in schools. And I do encourage people out there who are listening to this to recognize that if your child has a diagnosis of ADHD and they're showing an impact in school, right? So they're maybe falling behind academically, or they're having some behavioral issues in the classroom, there's a lot of support that schools can give your child. And so if you have questions about that, please let us know, because I can do another presentation on just the type of resources that schools can offer. Because remember, I'm formerly a school psychologist, so I was often part of the team that helped come up with strategies to support kids with ADHD. Whether or not the child was using medication or not, they still might need some support in school. And we want kids to have as positive of an experience in school as possible, because kids who haven't had treatment for ADHD and they've gotten scolded more by teachers, or they've had, social rejection, or they don't feel like they're a competent reader, like having a bad taste in your mouth about school when you're in those really, early grades can really impact kids' perspective of school later on and their sense of competence. We don't want these kids to feel like I'm dumb and I'm not good at this, and this isn't good for me. I'm not successful at this. Like, we don't want kids at these early ages to get that impression because they have symptoms of ADHD that they don't understand. So there's a lot of stuff that can be done with schools too.
Well, thank you, Dr. Egan. That's it for all the questions. Do you want to tell people about how they contact us?
All right. Well, if you have any future questions, please go to drtaraegan@gmail.com to send an email. Make sure that you join us live every Monday at noon Eastern Standard Time to talk about more topics that are related. I know one of the upcoming topics we're going to discuss is just to talk about those girls in, oftentimes a school environment where they feel very socially isolated, they feel invisible, they don't feel like they're connecting with their peers. And that was a request by a listener to say, what about those girls who don't feel like they're connecting with their female peers? So I want to talk about that. It's either going to be next week or the week after. So tune in for that. And then also, if you have a middle schooler or a high schooler, please check out and join our private Facebook group called Adolescence, a Parent's Guide, a support group for high school parents. There's a great group of parents in there who, have constructive conversation, very supportive. And so I really encourage you to join that. That's obviously a free resource. And then our podcast comes out with a new episode every Wednesday. It's called One Day You'll Thank Me. We have 5 more episodes of this season, and then we're rolling right into season 2. And we've got so many guest experts lined up, and I think it's going to be a great season. So join us for that.
Yeah, awesome. And people can also follow you on Facebook directly on your page, Dr. Cherry, and on Instagram.
Yes.
You have a lot of updates there as well.
That's true. I do try to give helpful resources and post what upcoming webinars are going to be on and what upcoming podcast topics we're going to be focused on. So yeah, absolutely. Join us on Facebook or Instagram at Dr. Terry Egan.
Well, awesome. Well, it was a great Thank you, Dr. Egan, for your time.
Thank you. I appreciate it. We'll see you all next week.